Today I'm going to talk about the neck. In this talk, I want to describe a patient situation that may be like your own. A patient who didn't recall his injury came into my office and with the complaint of pain that came down his arm and down the back of his scapula. We decided to try to treat him initially, and all the treatments that I knew that would help with this type of situation didn't work. So we got an x-ray, and the x-ray showed that he had an injury to the neck at some point in time. About 2 days later, he was able to describe the injury, which occurred when he fell down some stairs, a flight of stairs, and hit his head at the bottom. What occurred is that what we could see on the x-ray was that he had what we call a injury to his spinous process back here. It looked like it was fractured off, and he had some bony changes on the front of his spine that were like a bridge, so the bones had grown together. In this situation, what initially happened was he had a fall that caused a ligament injury. He had instability of his spine, and the body responded by growing more bone. It does this everywhere in the body. It makes the joint larger. It creates a bigger surface area so that the joint is more stable. It's a really good way to self-treat or self-heal, and it's innate to all of our bodies. However, when you have these bony spurs in this situation, in his situation, what it can do is it can grow into either the spinal column and have an impact on the spinal cord, meaning it can compress the spinal cord, and it can cause nerve-like symptoms that go outside to her scapula and the shoulder blade. That's what a lot of people think, and there's probably a component of a disc problem too. However, I think that the initial injury was related to his ligamentous structures, and that needs to be treated whether or not he pursues surgery. So let me just rephrase this. The initial injury happened. It caused instability of his spine. He grew some extra bone to make the joint wider and to help stabilize the vertebrae. And likely this bone is having an impact on his spinal cord in terms of causing a slight disc bulge and also some other changes in the spine. But even if he pursues surgical treatment, the original injury, the ligamentous injury, still needs to be treated. And so this is where I can come into play as an osteopathic sports medicine physician that specializes in regenerative medicine. We can use both the treatment algorithm in high-tech medicine, as well as some of the regenerative processes to treat pain and dysfunction and to prevent further injury down the line. Thanks. I'm Dr. Jennifer Stebbing. You can look at my website, drstebbing.com, for more information and a way to get in touch with me. I'd like to answer your questions. Thank you.